Welcome to the Learning Module, Entering Coordination of Benefits, or COB, for Medicare Part B. This video does not demonstrate the full claim submission process. If you have not submitted a Minutes Direct Data Entry claim before, please refer to the Minutes User Manual and select the appropriate instructions for your service. Let's learn more about Medicare Part B. Medicare Part B is part of traditional Medicare and covers medical services and supplies that are necessary to treat a health condition. This can include outpatient care, preventive services, ambulance services, and durable medical equipment. It also covers part-time or intermittent home health and rehabilitative services, such as physical therapy, if they are ordered by a doctor. If a member receiving services is covered by Medicare or other insurance, you must first bill the other insurance before billing Minnesota healthcare programs. After billing Medicare as the primary insurer, Medicare will provide you with an explanation of Medicare benefits, or EOMB. Providers will use the information from the EOMB and enter it into the COB section of a Minutes claim. In this video, we will show how an EOMB for Medicare Part B is entered into a Minutes professional claim. We will begin by logging into our Minutes account. Select Submit DDE Claims on the left navigation. This expands to show 3 options, and we will select the first option, Professional 837P. We will assume that you are familiar with filling out the first 2 screens of the claim, so we will jump to the COB screen. We will use a sample EOMB to complete our COB screen. EOMBs do not have a consistent look as they are created by different health plans. On our COB screen, we enter the other payer name, other payer primary ID, and select the appropriate claim filing indicator. In our example, the other payer is Medicare. Their ID is 1435, and we select MB-Medicare Part B for the claim filing indicator. Note, if we do not select the correct claim filing indicator, our claim will be denied. If you are unsure how to complete the fields on the COB screen, click the Help button in the upper right corner. This will open the Minutes Help-837P and 837D COB table in a separate window. We can use this resource when completing the different fields in our claim. Once we complete the Other Payer section, the page will expand to display additional fields on the COB tab. In the Expanded section, under Other Payer Subscriber, we select P-Primary from the drop-down list for the appropriate payer responsibility. Next, we will enter the insured ID into the corresponding field, which is next to the member's name on the EOMB. We enter the relationship code by selecting the most appropriate choice from the drop-down menu. In this example, we choose 18-Self. In the Medicare section, we enter the Other Payer's Claim Control Number. This is referred to as the Medicare Internal Control Number, or ICN. If our EOMB had payment remark codes, we would enter them in the provided table in the Medicare section. We will skip the Other Payer Amounts section. We will enter the payment information on the Claim Services screen, as this information is entered at the line level when reporting Medicare or HMO Medicare risk insurance. In the Other Insurance Information section, both the Benefits Assignment and Release of Information are defaulted to Yes. This is correct for our claim, but you should review this section to ensure it is appropriate when submitting your COB. We select Save to save the information that we have entered. Select Continue to progress to the Claim Services screen. On the Claim Services screen, we complete the information in the Services accordion panel as we would for any claim, and then click on Other Payer to expand that section. In the Other Payer section, we select Medicare from the drop-down list for the Other Payer primary identifier. Next, we complete the fields for the service line paid amount, adjudication payment date, and paid unit count. The paid unit count is 1. Using our EOMB, we complete the COB line adjustments entry section. We add the claim adjustment group code, adjustment reason code, adjustment amount, and adjustment quantity. In our example, we select CO from the Claim Adjustment Group Code drop-down list. We enter 45 in the adjustment reason code. We enter $60 for the adjustment amount and leave the adjustment quantity blank. We click the Add button to save what we have entered. We continue these steps to add all of the adjustments from our EOMB and click Save. If we had more service lines to enter, we would select Add at the very bottom of the screen. We only have one service line on our EOMB, so we select Save View Lines to open the claim review screen and validate the claim before submitting for processing. In this video, we have shown you how to enter the information from a Medicare Part B EOMB in a professional claim in minutes. If you have questions about submitting a claim, refer to the Minutes User Manual. The Department of Human Services offers various training opportunities, including other on-demand videos and online sessions. You can register for the online sessions by visiting the MHCP Enrolled Provider Training page on the DHS Provider website. Check the MHCP Provider News and Updates for announcements on changes to programs and information about new learning tutorials when they become available. Thank you.